This is the May meeting of the Pediatric Orthopaedic Society in North America, and we're interviewing our 1990 pioneer, Dr. Al Ingram, of our society. Dr. Ingram, first I'd like to ask you how you feel about your early education in orthopedics, and tell us a little bit about your chiefs and kind of how things have evolved.
Fine. Well, I graduated from medical school at the University of Tennessee College of Medicine in Memphis in 1939. I was a guy who was short of money all my life, and so I'm a man who's had a job every day of his life from the time he's 14 years of age until now. And when I was in medical school, it was necessary for me to have 3 jobs at the same time while I was taking medical education. And I was fortunate enough that one of those jobs was to work as an extern at the Camel Clinic in Memphis. That, at that time, consisted of Dr. Camel, Dr. Spencer Speed, Dr. J.F. Hamilton, who was an internist who did pathology and rheumatology, and then Dr. Harold Boyd and Dr. Hugh Smith came on the staff just at the same time that I hired on as a medical student in my sophomore year. I worked there until I graduated, and during that time we worked every other night. We were running the switchboard, we were doing surgical preps, doing lab work, taking x-rays, scrubbing in surgery, rolling plaster and wrapping plaster on patients. In other words, doing anything that people ask us to do. And we were paid the large sum of room, board, laundry, and uniforms, but no dollars. Well, it was a wonderful experience, though, because during that time we lived in the same quarters that the residents at the Camel Clinic lived, just across the hall from them. And so, for the first time, I had an exposure to intelligent, highly motivated, smart, hard-working orthopedic surgeons who were undergoing training. And of course, that was the thing that interested me in orthopedic surgery. Dr. Camel was chief of staff while I was in medical school, and he had many speaking engagements, not only nationally to medical societies, but he thought more importantly to local groups within 100 miles or so of the Memphis area, since at that time there were no orthopedic surgeons except in Memphis. There were 1 or 2 in Little Rock, which is 150 miles away, 1 or 2 in Nashville, 200 miles away, but the nearest were in St. Louis and New Orleans, which were 250 to 400 miles away. So he went around to various organizations such as the Lions Club and the Rotary Clubs and the PTAs and anybody else who'd invite him out to speak on orthopedic subjects. And he would usually invite one of us medical students to drive him in his car to the place where he was having his meeting. And so it gave us an opportunity to spend 3 or 4 or 5 hours with him, strictly in a one-on-one relationship. And he was very kindly disposed towards us young junior and senior medical students. And he was disposed to favor us and be very kind to us in many ways. For instance, when I had applied for an internship in my senior year, and at that time there was no matching plan for internships, and one applied to whatever hospitals he wanted to go to, and if they thought you were good enough, they would take you. If you weren't good enough, you didn't make it. So this particular time, I had been accepted at my second choice, which was Minneapolis General Hospital. But my first choice, which was University Hospital at Ann Arbor, had not made their appointments and were not going to for another week or 10 days. And the Minneapolis people told me that I had to accept or reject that invitation, but I couldn't keep them waiting for 10 days. And so it happened that on one of these speaking engagements of Dr. Camel, he asked me how things were going along, and I told him everything was going fine, except that I was in a real bind for my internship. And I explained my problem to him. And so, well, he said, well, when we get home tonight, you remind me of that again before I get out of the car, and we'll see what can be done about it. Well, I drove his car, and I let him out at his home, and I drove down to the Camel Clinic about 5 or 10 minutes drive away. And as soon as I walked into the lobby of the Camel Clinic, the other medical student who was running the switchboard at that time, Dr. Marcus Stewart, told me that he had Dr. Campbell on the phone, and Dr. Campbell wanted to talk to me. And so I picked up the phone. Dr. Campbell said, son, I've spoken to my friend Carl Badgley in Ann Arbor, and you've got nothing to worry about. You've got the internship. So then Dr. Campbell wanted me to come back there for my residency after my 2 years at Ann Arbor, which I did. So he was a tremendously important man in the development of course, the Camel Clinic, but more importantly, he was one of the founders and probably the one who had the idea for the development of the Academy. He was one of the founders of the board. He's one of the few people who was president of both the Academy, the board, and the AOA. So he was a very important person and very active in these early formative stages of the development of orthopedic surgery. Well, we had a very good experience with Dr. Badgley at Ann Arbor. He was a great man, and I enjoyed very much working with him, and George Hammond, who was a young orthopedic surgeon who has since went on to the Leahy Clinic and is now retired from there. But they were very kind to me, and I had a very excellent program, and I enjoyed very much being affiliated with them. So those are some of the people. Of course, we came in touch with Dr. Harold Boyd in Memphis, who was the chief of staff following Dr. Spencer Speed. And Dr. Boyd, probably more than anyone else, helped me set the pattern of my life, because he was also very interested in me. He was, of course, a very active man. He had been president of the Academy back in 1954. And to show his confidence in me, he asked me to be his program chairman for the Academy meeting. We pulled it off very well, and so that was the first significant job I had in organizational orthopedics, was as on the program committee of the Academy, which I chaired in 1954. And following that, I've had a number of committee appointments in the Academy and other orthopedic organizations.
How about Dr. Speed? I don't hear much about Dr. Speed. Tell us a little bit about
Speed
him.
was just the opposite of Dr. Campbell. Dr. Campbell was a hard-charging chief in the European nature of being chief. That is, he made the decisions. All of the patients were his patients, and it was the chief and a number of assistants working under him. That was the relationship between Dr. Campbell and all the people who worked around him, including Dr. Speed. But when Dr. Speed came along, he was just an opposite type individual. He had been able to work with Dr. Campbell and loved Dr. Campbell very much. But when he became chief of staff, the first thing he did was to institute the policy that each member of the staff, as he came on the staff, would identify a particular area in orthopedic surgery. This was before we even had subspecialty societies or organizations. But each one of us was to identify a particular part of orthopedic surgery that we wanted to grow and learn and become some degree of experts in. And so as each man came on the staff, then he selected some subspecialty area. Everyone had to do general orthopedics, everyone had to do trauma, everyone had to take care of general orthopedic patients coming in the office. But we had this nice arrangement in that, for instance, I decided I wanted to go into children's. I enjoyed working with children. I got along well with them, and so I identified a number of places, number of chiefs of orthopedics in children's areas, different parts of the country that I wanted to work with. And I would study the works of these men. For instance, Dr. Bill Green at Boston Children's Hospital. I went up there a couple of times. I would read everything I could that Dr. Green and Dave Grice had written, and I would go up there and spend a week or two sitting at their feet and learning. then I'd come back home and try to practice those things. And then the next year I would go and spend time with, say, Dr. Hiram Kite in Atlanta, who was a great expert in the treatment of club feet. That was one of the things that I enjoyed doing very much. And then I would come back and try to practice his teachings, and if I had questions, I'd communicate with him again. I also went to Dr. Ed Irwin, who was the chief surgeon at Warm Springs, and I thought, and I still think, probably knew more about poliomyelitis than anybody ever has. I went to New York to study with John Cobb and with von Lockham in scoliosis, and so this was sort of the way that I picked up whatever degree of expertise I ever was able to achieve in children's orthopedic surgery. And then the purpose of all this was to bring it back and to enrich our training program and enrich our health care program so that we could deliver better care to the patients who came to us.
But you never got a chance to see Hoke. He probably had
No,
wasn't very active.
Hoke was gone.
And Guy Caldwell, was he?
Guy Caldwell was a very close friend of Dr. Spencer Speed. And Dr. Caldwell was born and raised in a town just about 75 miles southeast of Memphis, Corinth, Mississippi. Town that was well known to me. And Dr. Caldwell was a very close friend of Dr. Speed. He used to visit with him very frequently. And he was a dear and a very scholarly, very distinguished looking and acting person. And Dr. Caldwell made very significant contributions to organizational medicine, as I think of it. That is, he was chairman of the Council on Medical Education of the American Medical Association, which is a very important job. And I think possibly he's still the only orthopedic surgeon who's ever had that particular position. Dr. Caldwell and Dr. Speed got along very well together, and he came and visited frequently in Memphis those times.
And Dr. Irwin was famous for being the President Roosevelt's doctor.
Yes, well, actually, Michael Hoke was the one who was the first chief surgeon at Georgia Warm Springs Foundation. Dr. Hoke was one of the giants of orthopedic surgery, and he trained some of the most outstanding orthopedic surgeons, and he was one of the smartest, most intelligent men. He didn't write much, but he had people coming to sit at his feet, mature, fully developed orthopedic surgeons coming there to learn firsthand from working with Dr. Cope. But Dr. Hope trained Dr. Hiram Kite, who was the chief of surgery for a long time at the Scottish Rite Hospital in Atlanta. He also trained Ed Irwin, and he trained a number of other surgeons who went on to have leadership roles in the development of orthopedic surgery, particularly in the southeastern part of the United States. Shriners Hospitals, he was the first chief of the Shriners Hospital on a national basis, chief of the medical board at the Shriners Hospital. He was really a great orthopedic surgeon. Unfortunately, I never did get to know him. He died at a rather early age, but I did have the opportunity to study under some of his better students.
What are your feelings about our obligations as orthopedic surgeons to the national community and to the national medical community and such?
Well,
how do you feel about that?
I feel very strongly that I think, of course, we have obligations to the patients who come to us. And I think, obviously, that's our first commitment and our first obligation. But I think that for many years, orthopedic surgery tended to exist in a sort of an ivory tower. I mean, it's very easy for us to come to a meeting like this one today where we are all pediatric orthopedic surgeons. We all speak the same language. There's no real conflict between us, and we're not thinking about socioeconomic matters. We're not thinking about societal pressures that are impinging upon the practice of medicine at the local, state, or national level. We're not thinking about malpractice or medical legal problems or anything else. We're just focusing down today on the technical basically the technical aspect of taking care of patients who are pediatric patients who have orthopedic problems. Well, I think it's very important for us to make to devote a great deal of our time and to exchange information that we have gained in this area. But I think for, to be a real physician, I think a person has to have a broader view of the practice of medicine than that, and a broader view of our responsibilities as a profession to our patients and to society at large. And so I think that that it's very important for us not to be focused down and to limit our activities and professional pursuits to exclusively to the practice and to the study of orthopedic surgery. I first got interested in expanding outside of orthopedic surgery back immediately following the development of the polio vaccine. Before that, I had been treating all the polio patients that occurred in the area, in the Memphis Medical Center, in addition to doing my other work as an orthopedic surgeon and taking care of crippled children and all the rest of it. But it was my responsibility to handle the musculoskeletal part of polio as the epidemics came along. And in 1953 or 4, I believe it was, we had something like, I treated something like, I think it was 590 patients between the 1st of June and the 30th of September. That many new patients who had poliomyelitis, and we had patients scattered out in hospitals all over the city. So after the introduction of the polio vaccine, then the Polio Foundation was making sounds that they were going to go into arthritis and a number of other medical conditions. And I had had some trouble. I'd been the medical advisory chairman of the Polio Foundation locally for several years, and I'd had some trouble. I thought that some of their policies in dealing with physicians who were actually rendering the care that they were paying for, they didn't pay us for care, but they were paying for hospitalization, and they were taking credit for all the work that we were doing as physicians. And I felt that the medical advisory committee on a national level should exert more influence with the Polio Foundation, particularly if it was going to expand and get into congenital malformations, arthritis, and a number of other conditions like that. And so I drew up a resolution that I had introduced into our local medical society, and for the first time I got interested in the local medical society, and it was passed there. Then I introduced it into the Tennessee Medical Society, and it was passed there. And then I took it to the AMA, and it was referred to a committee, and I appeared before that committee 2 or 3 times, and I appeared before the House of Delegates on 2 occasions. And I was absolutely amazed at how easy it was to influence policy with the American Medical Association, and how important it was that here's an organization that was large enough that could demand to be heard, and could be heard by an organization such as the National Foundation for Infantile Paralysis. I wasn't trying to restrict them in their activities. I was simply trying to get an organizational setup such that that the physicians who were actually rendering the care could have some input into the decisions that were made at the top levels of the Polio Foundation. Well, as a result of that, I became active in our local medical society. I became president of the medical society the next year. And then Dr. Boyd, who was at the Camel Clinic, had been the delegate to the AMA from Tennessee. And he didn't really enjoy that work, and he wanted to spend more of his time on professional pursuits, more orthopedic pursuits. And so he asked me if I'd be interested in having my name put up for that. So I became a delegate to the AMA from Tennessee, and as soon as I was there, I was put on the AMA Speakers Bureau. At that time, we were beginning to fight the King-Anderson bill and the beginning of the Medicare legislation and all that. And I was in the House of Delegates at the AMA for 2 years, and there were a lot of things going on at the policies of the AMA that I didn't really go along with. I thought didn't really represent the people who are out there in the boondocks practicing medicine and treating patients on a daily basis, particularly, and trying to do it in a quality way. And so I ran for the Board of Trustees of the AMA, and I ran against an incumbent, and for the first time in I don't know how many years, I was able to defeat an incumbent member of the Board of Trustees. The normal thing was that a person would be reelected until his third term, until he could no longer be reelected, and then he'd resign. But this man just happened to be from my part of the country, and I ran against him, and I was elected. And I stayed on the Board of Trustees of the AMA for 6 years, and spent a very great deal of my time and a great deal of my energy and efforts working. I think that, you know, don't ask me exactly what I accomplished, but I think that that not only did I come along at that time, but a number of other people who were younger and less politically oriented and more professionally oriented in trying to serve as the advocate of the patient and the advocate of the profession and so forth, and advocate of specialized medicine. And so I think that the Board of Trustees of the AMA, and therefore the AMA, has been a different organization since that time that this group of us came onto the board at that time. I stayed on for 6 years and probably would have stayed another 3 years and had been invited by some politically significant groups of people like the California Medical Association to run for president of the AMA. But at the same time, Dr. Boyd was ready to retire as chief of staff of the Camel Clinic, and I was told that that they wanted me to be the chief of staff there, and so there was no way that I could do the work at the AMA and be chief of staff at the Camel Clinic at the same time. So I let when my term expired for the Board of Trustees, I didn't run for re-election. I didn't run for the presidency or anything else, and I stepped out of the AMA at that time and became chief of staff of the Camel Clinic and started back into orthopedic surgery, which I had been away from for the previous 6 years because of these AMA duties. But I enjoyed very much being a part of the AMA and a part of the decision-making process. And I enjoyed it because I felt that coming from a favored specialty such as orthopedic surgery and a favored group such as the Camel Clinic group is, and still is, that I had an obligation not only to my patients and to the specialty of orthopedic surgery, but to medicine at large and to the public at large. And I think that at that time, and I believe still, that the AMA is an important organization, particularly in dealing with society at large, political organizations and so forth.
Now, you've been the president of the AOA, our American Orthopedic Association, and the chairman of our residency, of our examining board, and I'm sure you're proud of those positions, but you've told us a unique thing here that few orthopedists can talk of. Your involvement in national groups that aren't completely orthopedic. Right. But you have some other groups that you've been involved in that haven't been completely orthopedic.
Well, as I said, I just have had the feeling all the time that the practice of medicine was a great privilege. I felt that from the beginning, particularly from the fact that I came from having essentially no money as a background. I was the first member of my family to be college educated, and I have just felt that I've been favored, and that as a result of that, I have an obligation to society. And so before I became active in my local medical society, these years that I'm talking about, I volunteered to work with the National Polio Foundation, both locally and nationally. I was the chairman of the Medical Advisory Committee for the Polio Foundation for 6 or 8 years, and I was chairman of the Medical Advisory Committee for the Easter Seal Society. I worked with the Shrine School System locally, the Board of Education and special education programs, and all that sort of thing. I feel that that's a very important part of the obligation that we as physicians have to society. I think those people need an input from physicians, particularly these organizations that have a medical leaning, like Easter Seal Society and the Polio Foundation and these things. I think that, and I think that we have an obligation to not necessarily run these organizations, but we need to have an input into their decision making, especially as it relates to health care and patient care and research activities. I think that we have a great thing that we can contribute to them, and that we should be willing to do it as a part of the privilege of practicing orthopedic surgery.
Then you became chairman of a department and responsible for orchestrating a whole lot of things, but especially training young people in orthopedics, and that must have been well, not a new challenge, but the orchestration of it must have been.
Well, it was as I said before, when Dr. Speed became chief of staff at the clinic, he started the subspecialization within the clinic, which we'd never had before, and I decided I was going into children's orthopedics, and so I spent some time at these places that I've mentioned before, with these teachers that I've mentioned before. And so I became the chief of the children's program, and so all the time I was there working as a staff member of the Camel Clinic, I was in charge of the children's aspect of the training program with the residents. So being moved from that to the chief of the residence program wasn't that much of a change. It was more responsibility, but the teaching went on, and I was still teaching basically the same thing. When I became chief at the Camel Clinic, there were a number of things. I had been there since I was a sophomore medical student, so I knew the place upside down and inside out, and I knew a lot of things that needed to be done. And we did a lot of things. I was chief of staff there for 6 or 7 years, and we did a lot of things that were of value to the patients primarily, but also to the staff. We set up profit-sharing funds and pension systems and retirement system and work schedule. I mean, it was just sort of a vacuum at that time, and they were just waiting for someone to attempt to show a little leadership. I don't mean to say that I did it all, because I didn't. Everything we did on a democratic basis, but still, someone had to take the leadership role in achieving the things that were done. And running the residency training program was, a lot of that is delegated out to other people who are running certain aspects of the program. And then of course, working with the university and being on the university committees, I felt that we had an obligation to spend a lot of time there, because the Camel Clinic was, is, and has been the Department of Orthopedic Surgery for the University of Tennessee College of Medicine. And I felt that we needed to be, to have a close relationship to the other members of the faculty, and that we wouldn't be just sitting out in our little building and doing our little thing, that we had to participate in the entire academic affairs of the university. So I had an interesting period of time as chief of staff at the clinic, and I was chairman at the university at the same time.
And you have some wonderful stories, I'm sure, of residents that you might not want to record.
Right. Oh yeah. Well, we had a great relationship with our residents, and I say, when I retired as chief of staff at the clinic, one of the nicest things that ever happened to me, I guess the nicest thing, Lee Milford, who's a good friend of mine and subsequently was chief of staff at the clinic, and is a very well-known, very famous hand surgeon. When I was going to retire, and they from the clinic, and they have a little party for you and a presentation and so forth. But Lee wrote a mimeographed form letter to all the people who had trained there during all these years that I'd been connected with the clinic, and I think the number was something like 152 or something like that, residents had turned out at that time. And he told me that I was retiring, and that if anybody wanted to write a letter to me, he'd bind them together. Well, I had 137 letters
That's terrific.
from these fellows that had trained there during the period that I was there. So it was a very warm feeling, and one of the nicest things that's ever happened to me.
The other nice thing for children's orthopedists must be to see long-term follow-up on patients and start to see the patient's children,
Yeah.
and so on. I'm sure you've
Oh,
had that.
absolutely, yes. I think that I still have, I've been retired now 6.5 years from the Camel Clinic, and I still have, almost every week, I have people call me who were patients of mine before. Of course, they're not really asking me my opinion now. They're asking me to put them into the system, in touch with the right person for the particular problem. But to me, that's a great compliment. That means that they still have confidence in my judgment, and I appreciate the efforts that I gave towards them.
If you have a pioneer's message that we should take, what would that be?
Well, I think that I would say that we as orthopedic surgeons have been greatly favored by society, and I think that we have an obligation, number one, to our patients. We have an obligation to our family, and it's very easy to forget that and to get so involved that we don't have time to be with our family, in particular our growing children when they're going through these critical stages. But we have an obligation to our orthopedic surgery and to our family, and we have an obligation to medicine at large, and we have an obligation to society at large, because in the final analysis, society grants us the privilege to practice medicine. This is not a right. We have no right to practice medicine at all. We're granted the privilege, and along with that privilege goes the responsibility of, first of all, practicing in an honest, ethical, and above-board manner, passing our education on to those who come behind, and to being the advocate for the patient in all the things that we do. So if I had any message, that would be what it would be, Mark.
Well, Dr. Al Ingram, thank you very much for being our pioneer of the year here and taking this interview with us. Thank you.
Well, thank you very much, Mark.